been in this hospital for 7 days, for a whole week. I came in January 7th. Today is January 14th. And I just believe by faith that I will be healed from this, that this is just the start of my testimony, and that God will completely heal me, and that I will look back on this and rejoice and see how far God has brought me through.
3 weeks ago, I had a hysterectomy because I was diagnosed with leiomyosarcoma. But that was only after I pushed for the doctors to do something about the pain that I was in. I was told by the doctor that my body was just regulating itself, and they gave me medication and essentially told me to lay down. I know my body, and I know that something wasn't right. And after they continued not listening to me, I pushed for them to give me an ultrasound. I pushed for them to give me an MRI. And what they found is that I had 8 fibroids. One was impeding into my uterus. The one that was impeding in my uterus, they said, well, we can just give you medication to balance out your hormones and to shrink the fibroids. But I pushed for them to do something called a hysteroscopic myomectomy to get that fibroid out of me. That one fibroid that they took out was the one that was diagnosed with leiomyosarcoma. If I had not pushed for them to do more for me, I would have still had cancer in my body, spreading in my body. If you feel like something is up with your body and you feel like they are not listening to you, that they won't do anything for you, continue to push and advocate for yourself, because this is a very sad situation and it did not need to happen.
Welcome to the National Newspaper Publishers Association's Let It Be Known. And we have often on this program, as you all know, spoken about Black women's health and Black women in general. And we continue to see situations like what we're going to talk about today with our 2 special guests. Um, Faye McCray, a health journalist and former health attorney, and Robin Ayers, an entertainment journalist and host on KBLA 1580 with Tavis Smiley out in Los Angeles. But we're gonna discuss that, and we're also going to discuss Candace Owens and her platforming by folks like Charlemagne and Joe Budden and others, and her now seeming attempt to become Omarosa #2 when she no longer has a home among the other folks. She wants to come home to Black folk, it seems. But importantly, we're going to tackle this serious health situation with Black women. The tragic loss of Jessica Pettway, a vibrant beauty influencer who tragically lost her life at the tender age of 36 due to cervical cancer. Her journey, though deeply personal, resonates far beyond her immediate circle. Jessica's battle shed light on the intersection of race, gender, and healthcare disparities, particularly, of course, concerning Black women and cervical cancer. For Black women like Jessica, the stats are very much sobering. They face a disproportionately higher risk of cervical cancer mortality compared to their white counterparts. Despite medical advancements and accessible screening tools, the reality is that people, especially Black women, shouldn't be losing their lives to this preventable disease. Medical experts emphasize that cervical cancer is largely preventable and treatable when detected early. Yet systemic issues such as lack of access to quality healthcare, medical mistrust, and racial biases in diagnosis and treatment continue to contribute to the devastating outcomes within the Black community. Let's welcome our very special guest today, Robin Ayers. Thank you for joining us. And of course, Faye McCray. We really appreciate both of you. Um, First and foremost, listen, Robin. I know we've seen a lot of um, things that you've posted and you've spoken about. Um, the disparity in cervical cancer mortality rates among between Black women and white women is stark. Tell a little bit, and Robin, you can do the same thing about the systemic factors that contribute to this gap, and how can healthcare policies be reformed to ensure equitable access to preventive care and treatment for Black women?
Is that Faye?
Is that for
Both,
me?
yeah, either one could start off.
Well, Robin, first, I just want to thank you for sharing your story. I mean, stories like that save lives. So just thank you so much for sharing that in your platform. This is just so unfortunate. And it's like Robin said, it was completely avoidable. And what we know is that Black women are 41% more likely to develop cervical cancer than white women, and 75% more likely to die from it. So we know that these stats are staggering, and we know that a lot of the flaws are existing right within the medical system. We see what happened to Jessica. She presented with her problem almost a year before she received the diagnosis, which is unacceptable. We know medical gaslighting is a thing. Doctors don't believe us. And self-advocacy saves lives, but we also need to be putting the onus on the healthcare system.
Yeah, and Jessica, I have to echo what Faye said. Your story, the bravery, the courage in which you tell it, is so important. When you heard of Jessica's story, Robin, what first came to your mind as someone who has had to deal with health issues like this?
Yeah. Um, I just always want to send a rest in peace to any women who I hear have gone through something like this. And the same would be with Jessica. Um, it was very unfortunate for me. I know that once I discovered things like this were going on with my body and just medically, I had to be an advocate for myself. And it isn't until certain times you put yourself out there and you talk about your own situation that you realize how many other women are going through this. So yeah, we can read the stats, we can find out, we can do our Google research, we can ask people like Faye. However, personally, it doesn't necessarily hit home until sometimes you put your own self out there. And thankfully, I've done that and opened up what seems to be a new community for myself of women who are going through the exact same thing. And I said, once I got through this, I knew I was going to get through my own situation, which was being diagnosed with leiomyosarcoma. Once I got through it, I knew that I was going to promote advocacy, because you're right, Faye, when she mentions, we're not believed. Women, oftentimes, especially Black women, when we complain about different pains in our bodies or just anything that we may be going through, oftentimes we're not believed. And you have to push. I know that now. You have to push. You have to advocate for yourself until someone hears you and does something about it. And so, it's something that I vowed to say I'm going to continue to speak about until I personally start to see some change. And then I'm going to continue to create a larger community, as far as I'm concerned, to help other women who might be facing the same thing.
Yeah, and Faye, the story, a part of Jessica's story, she was initially diagnosed, I believe, at least it was believed that it was a fibroid problem, lots of bleeding, um, a number of blood transfusions. How do they miss this? How do they miss this? This is a vibrant young woman, beautiful family, husband and two kids. How did they miss this, Faye?
Yeah, I mean, it's a great question. And I think it's one that we all have, right? I mean, I believe reading in her story that she was found unresponsive. That's how
Yes.
much she had bled at one point by her husband. To me, as a layperson, that goes beyond fibroids, right? But I think oftentimes, again, when we go to these doctors, they make assumptions about who we are. We know fibroids are common in Black women. And what we find very often with medical gaslighting and misdiagnosis is that they make presumptions based on our race. They make presumptions based on our station in life. And after that, it's very hard to convince them otherwise, or at least obviously a poor medical experience or a not great doctor.
And can
And
I
go
add to
ahead.
that?
Sure,
Uh,
Robin.
and what I found, which is so interesting, again, it's not until you go through something yourself until things begin to open up for you, your own experiences. And oftentimes, what I've realized is that we go with the first thing that we're told, because someone is they are practicing. medicine, you believe what you're being told. That's what we've always been taught. You go to the hospital, whatever the doctor says to you is what you believe, and that's what you go with. However, this is not to take away from any physician by any means, because I do believe in practicing medicine, and we need to lean on them and their expertise at times. But at the same time, I'm also now an advocate of getting a second opinion if need be, getting a third opinion if need be, switch doctors, switch organizations if you have to, in order to be understood and heard, and for something to be further done about your particular situation if it doesn't resonate with you.
And Faye, along those lines, and I've heard it's interesting that Robin says that, because I've heard folks say, "Well, I can't change. I'm locked into this healthcare for the year. This healthcare coverage. I'm locked into this primary care doctor for at least a year, et cetera, et cetera." What do you say to individuals like that, particularly when you see um, folks, your life is on the line here?
Yeah. And it's understandable, right? I mean, the state of the healthcare system is scarce. Like, it's hard to find a provider. You want to get a second opinion, you got to wait another 6 months sometimes, But I think one of the things that I love, Robin, in the telling of your story is that you knew something wasn't right. And you didn't ignore that voice. And we cover so many of these issues, for the publications that I work with all the time, of issues of people talking about their journeys to diagnosis. And usually they persevere and they are advocates for themselves because they know something isn't right. And I would say, don't ignore that feeling. There are options. It takes the footwork. Robin, I'm sure you can speak to that. Like, you got to dig, you got to do it, but it's worth it, right? It's worth it in the end.
And
That's
it's
what
not
you
easy,
said.
right, Robin?
That's the key.
Yeah.
You said it's worth it. Sometimes, if you were looking at your situation and you knew that you were diagnosed now, you would do anything possible. It doesn't matter the cost. It doesn't matter the legwork. It doesn't matter the effort that you have to put in. You would do anything possible if you were looking at something that told you that this was your diagnosis was, and possibly you could die from this.
Yeah.
How many people get to that place where, sadly, you get to that place where you're like, you know what, nothing matters anymore. I would do anything to switch, and to do something for myself. So the goal, obviously, is not to have to go that far, not to be met with that diagnosis. But, I'm just making the point that to that end of the spectrum, it is that serious. When it comes to, there are all kinds of hurdles that you may have to go through when it comes to healthcare. We know that in the United States. But what would you do if you were faced with that sort of diagnosis and you were faced with that news? What would you do if you had another chance? You would say, you know what, nothing matters. I will stop at nothing to change my situation.
Yeah. And Faye, how can healthcare providers, how can they build trust and establish culturally competent care practices to better serve Black patients, particularly Black women, and address this rampant medical distrust that African Americans have in general?
Yeah, I think it starts with transparency around knowledge gaps. So I think what we find often in these stories about misdiagnosis is there's a healthcare provider that was just convinced that they knew exactly what was going on, rather than saying, hey, maybe I don't have expertise in this or this particular population, and I need to refer this person out. I think availing themselves of culturally competent training is incredibly important. Understanding the demographics that they work in, but also the demographics that may show up at their office that they're not accustomed to working with. I think that's very important, and understanding, again, the mistrust with which people arrive at doctors' offices, and acknowledging that, and really validating that. I mean, we know that there's just so many things within the history of the medical system that have justified some of the mistrust that we experience in our communities. And I think when doctors can acknowledge that, I think it goes a long way in building relationships.
Yeah. As a community, again, going off what you just said too, what onus is really on us here? I mean, I know you got to take control of your you have to take control of your own health situation, yes, but what else can we do as a community to try and stop or stem this tide of Black people, particularly Black women, dying from things they shouldn't die of? What can we do?
Yeah, I mean, I would say, the onus obviously isn't entirely ours, but the quote goes, the most common way that we give up power is by thinking that we don't have any, and we do. We do. We have the right to switch. We have the right to ask questions. We have the right to switch providers. So I think it's a matter of taking ownership of our health. In this case, I mean, what could have been done differently? To Robin's point, she believed her doctor. Why wouldn't she have believed her doctor? And unfortunately, what could have been avoided wasn't avoided, but stories like this we learn from. If you're feeling like something is wrong, if you're feeling like you need better care, seek better care.
Yeah.
I
Yeah.
agree with you on that, Faye. The other thing, Stacey, if you don't mind, I'll add
Sure.
is I think traditionally, historically in our community, uh, we've just not gone to the doctor. We have just not gone to the doctor. Something is going on in your body. You take a little pill for it, hoping that it'll go away. Back in the day, they would say, take some Robitussin. That's sort of a running joke in our community. Take
Yep.
some Robitussin and lay down, right? And it's just like, well, I think that we're much more aware now. We should be much more aware, much more exposed to what's going on, in that we do have power, like Faye was saying. And first and foremost, if you know that something is going on with your body, don't wait. Do not wait. Go. I mean, because then you could say, yeah, a part of the onus will be on us. It will be on you. If you knew that something was going on and you waited too late, if you felt, something in your breast and you said, it'll probably go away. I'm just going to ignore it until it goes away. We can't do that. We cannot do that anymore. If you feel like, because you've lived with your body however many years, and you better than anyone else before any testings or screenings. So if you do feel something going on, absolutely go to the doctor and get that taken care of.
Yeah, and Faye, one of the things that stood out in Jessica Pettway's story, many things stood out, but one of the things that stood out, she mentioned how she had spoke to so many of her girlfriends and others, and saying, I got this going on. What do you think? I got um, that conversation. We don't often hear, because as Robin just said, hey, take this pill or take the Robitussin. They used to say back in my day when I was younger, Mercurochrome, whatever that is. But but she talked to a lot of her peers, it appears, and talk about, if you will, the importance of that community collaboration. Even though her situation ended tragically, that community collaboration, how important is that?
Yeah, I mean, the first thing that I thought of when I heard about this is the maternal mortality rates as well. Black women are 4 times more likely to die of pregnancy-related causes. And I thought about what we're seeing spark up from that, and that's community, right? It's doula services, it's midwifery. We're going back to the basics and working within our communities to heal one another. So I think it can never be underestimated how valuable it is to talk and consult. You always ultimately need to consult with your doctor, but I think that that's where it starts, right? That's where it starts.
Right, right. Um, so we saw this vibrant, as we said earlier, this vibrant influencer, and not just because he's an influencer or was an influencer, but this mother, this wife, this daughter, um, lose her life, and her family now suffers because of it, because of a misdiagnosis. How infuriating is that, Robin, for particularly for Black women?
It is so infuriating. Again, sometimes it doesn't necessarily hit home until you've been through something personally. My goal, honestly, is to get people to understand, emotionally attach themselves to stories like this, even without having to go through it. And that's why I will continue to speak on it. I'm not far removed from my own situation. This was very, very recent. It was just last October in 2023 when I began to experience symptoms. I just had a full hysterectomy. It wasn't a full, it was a partial hysterectomy in February. So all of this is very, very new for me. And so it could be maybe my passion that speaks behind it right now. But again, it's also a vow to continue to talk about this because, again, sometimes, and I think very often in our community, we may look at a story, read a story and say, this is so sad. And then we continue to scroll on.
Yeah.
But
Yes.
you know, what is that bridge in between? Where can we galvanize behind stories, like not just stories, but this entire thing that affects all of us? How can we galvanize? And I think a part of it is sharing our stories. A part of it is sharing how infuriating it is. And again, trying to get other people to emotionally attach without having to go through something like this personally.
Yeah, I think too, that's why it's so important that we share our stories because we see ourselves. When I was watching your story, I was getting a little choked up, Robin, because it was like, this could be my sister, this could be my cousin, this could be my friend, and that's just another layer of why it's so valuable that we're sharing these stories.
Yeah.
Yeah, and again, Robin, the courageousness in which you speak, and being that recent too, we certainly applaud you and lift you up as much as we can, because we listen. I'm sure it can't be easy for you or your family, but that that resolve that you're showing, and Robin is speaking on it here. That resolve you're showing is just incredible. um, Faye, you've already stated how it moved you, but um, talk about how can we get more consistently, Faye, because you're a journalist as well. Um, how consistent we can get this message out to people who need to hear it.
Yeah. I mean, it's so incumbent upon journalists. I know regularly I chat with my staff about this pledge, right? That we're going to work with diverse talent. We're going to get diverse writers, but it's not just about that, right? It's about diverse stories. It's about sharing stories where people see themselves reflected in content. And I mean, it's important. It goes beyond a quota or beyond an obligation. We see in this story, it changes lives.
Yeah, because we often will um, report on what stats say, and do it from that lens. But real stories, right, is what really is going to hit home. I mean, this story hit home for all of us. Jessica's story hit home for all of us. Real stories. We don't need it to be tragic, right? Um, but it can be inspiring when you see someone, and Robin, taking full control of the situation. So with that, Robin, I know that you have a pretty big platform yourself. Um, and is there a social media or even an organization that you might have hooked up with to help advance your story?
That's a great question. Not necessarily. I am sort of at the very beginning stages of this commitment that I've made. So right now, what I'm doing is just utilizing my own platform, and it seems to resonate with a lot of people, which is great. I know that I can't do it alone, and so my hope, is that I am able. So that's why I appreciate being able to have this conversation here today. Is the more we can talk about this and bring awareness, and then make it so relatable. Jessica Pettway's story is going to reach a lot of people, not only because she was a YouTuber and a lot of people can relate to being an influencer or content creator, but for me, immediately when I saw that she's married and had two beautiful children, the same as me. I am married and I have two beautiful daughters, the exact same situation. And so, whatever it may be, you might be a man looking at her story and say, I have a wife and I have children, and it'll affect you that way. So, the goal for me, to go back to your question, is no, I have not necessarily partnered with or connected with any other organizations, but that's certainly a goal for me. And just to tell my story as much as humanly possible, it'll just so that I know it'll resonate with more people. That is definitely a goal for me.
Yeah, and again, you telling your story now, again, so soon too, and so early in your process is just it's inspiring already to me anyway. And you mentioned it. I mean, I have a wife. We have uh 4 girls,
Mm.
and I have nieces and aunts. A mother. So this should not just be Robin, and maybe you could speak more. I mean, Robin, Faye, maybe you could speak more about this. It shouldn't just be a woman issue.
Mhm.
No, yeah. I mean, I have 3 boys, so I'm on the other end of this, and 2 brothers and a husband. And, for me, it is so important that they understand kind of what's going on with Black women and their role in supporting and advocating. So, yeah, and not just Black people, right? This should be an everyone issue to be thinking about
Everyone,
these
yeah,
things and solving for them.
That is
yeah,
so good. That is that's the hope. That is definitely the
Yeah.
goal for and to be honest with you, men being able to be more educated on this, because what I've run into is a lot of men who say, you know what, my mom recently found out that she has fibroids, or my mom recently had a hysterectomy, but they don't know much about it. So again, if this topic, and not just cervical cancer, but any sort of women's issues, reproductive issues, if that can be, if we could spread education and awareness for everybody, that would be ultimately the goal.
yeah, absolutely. And Faye, again, before we end this segment, kind of break down to us, if you will, you know, a direction for Black women when it comes to their health. I mean, you both, Robin Ayers and Faye McCray, have both kind of spelled it out totally today. But break it down for us and give people a sense of where you're coming from, where we're coming from, or trying to come from here this afternoon.
Yeah, I mean, I would say the takeaways for me are self advocacy, right? You want to advocate for yourself. You want to own your power to switch providers, to ask questions. You own your health journey. So, owning that, screening is increasingly important. I mean, we see these rates not just with cervical cancer and pregnancy, but we also see them with breast cancer, just astronomical disparities now in those spaces. So you want to be going for your annual screenings. You want to be listening to your body, and I would say, lastly, really demanding that culturally competent care, so making sure that you feel comfortable with your providers. And if you don't, changing and switching.
Yeah. And clinical trials. We That's something else we don't tend to participate in, Faye and Robin. Uh, should that are we in a place where we trust enough to participate in, or should we trust enough to participate in clinical trials? That question comes up a lot.
Yeah. I mean, I certainly, understand the mistrust, right? But part of the reasons, for some of these disparities are that we're understudied, right? And that we're just not a part of these focus groups. So I would say, you want to obviously go within your comfort level, but we do need to see more of our participation in clinical trials.
Yeah, I see Robin shaking her head saying absolutely.
Definitely. I think that was spot on. Absolutely.
Yeah.
Yeah,
Yeah.
because we hear a lot about what is that guys, I don't know why it would slip my mind. 100 years ago, what happened with the syphilis thing, and what do you call that situation again? Why is it slipping my head? But
Tuskegee,
say
Tuskegee,
again, Faye.
Tuskegee. Is that what you're thinking about?
Exact, 100%.
Yeah.
The Tuskegee experiment. That's always the first line of no, we're not doing it. Look what you did, with the Tuskegee experiment. But we're long past that, right? At least we hope we are. So,
We'll get there.
but let's
We'll get there.
we getting there. So, yeah. Well, yeah. Because again, you both have spoken, um, about this, and it's mistrust. It's still a lot of mistrust, and it's earned mistrust, right? We're not just making stuff up.
Yeah,
So
I mean, you cited historical examples, right? It's earned, but it's time for us to get to a place, where we're working in cooperation so we can get the care we deserve.
Yeah.
and lastly, again, the importance of having medical providers who look like us. Both of you, just real quick, can you speak on that?
Yeah, I'll 100%. Thankfully, there's a girlfriend of mine who is, she's a Black woman who is doing wonderful things in the medical community. And we've had conversations about this. If we can just, I think it starts young. It starts with talking to our children. I know that YouTubers and content creation and all the whole influencer thing has become sort of the new entertainment / sports that everybody once wanted to do. But it's like, let's talk to our children about the importance of the medical industry, and promoting that. One of my daughters, I have 17-year-old twins, and they're getting ready to go off to college, but one is interested in marine biology. And I thought, that's amazing. I just think that that's wonderful. And she wants to make a difference there. We're not talking about humans necessarily, but, she wants to make a difference in the world. And, my other is interested in becoming an attorney. And I'm like, that's beautiful. We need to, start to advocate for that, in the medical industry.
Yeah. Well, we really appreciate it. Faye McCray, we know you got to run. Health journalists, we really, really appreciate you. Thanks for joining Let It Be Known.
Thank you.